Okay, for the muscle test of the hip, your patient is going to start supine. Please make sure that you drape them appropriately. For quadriceps and hamstrings, if you'll instruct your patient to bring their knees up, and you're going to take your arm and tell your patient, I'm just going to put my arm underneath your knees. Okay. So then you're going to loop through one knee under and then have the other over so that you can have a leverage for one of the legs. And then you'll bring the leg up slightly, and then to test to test quadriceps, you're going to apply a downward pressure. They're going to meet your resistance here for 5 seconds. And relax. Any pain with that? Nope. And then come under to test hamstrings, meet my resistance here. 5 seconds, and any pain with that? Nope. Then you can switch and go through. So again, if you can look through here, so I'll put my arm underneath one leg and then on top of the other. So it's a scooping motion. Then for hip adduction and abduction, we'll bring the legs down. So you can bring the legs slightly out and then because we're testing the hip, you want to be above the knee. So then, Carol, you're going to meet my resistance here, and you can stabilize here at the hip. All right, and relax. Any pain with any of that? Nope. And then you can then try and come down here, again at the distal femur, and then pull out here and meet my resistance here. And relax. Any pain with any of that? Nope. Then you can switch to the other side. And then for Iliopsoas, you're going to have the leg in a 45, 45, 45 position. So we're going to bring the leg up 45 degrees, out 45 degrees, and externally rotated 45 degrees. And then we're going to apply downward pressure here, so meet my resistance. And relax. Any pain with any of that? Switch to the other side. And then for the next two, then you're going to flip your patient prone to test the Piriformis. So always help your patient move the drape and make sure to re-drape there. Okay, so then you'll bring one of the knees up, and then because Piriformis is an external rotator, remember we're bringing it in, and then you're going to have them meet your resistance here. So meet my resistance here, Carol. And relax. Any pain with any of that? Nope. Switch to the other side. And then for Tensor fasciae latae, we'll have them sideline. So again, just kind of tuck the draping there. Thank you. Okay, and then because again we're testing the hip, bring that leg up here. Perfect. And then meet my resistance here. And relax. Any pain with any of that? Nope. And that completes the muscle test for the hip.